Welcome to This Week in Health IT. Today, Seth Pazinski from the ONC for HIT joins us to discuss the 2020 to 2025 Federal Health IT Strategic Plan. My name is Bill Russell, former healthcare CIO coach, consultant, and creator of This Week in Health IT, a set of podcasts, videos, and collaboration events dedicated to developing the next generation of health leaders. Special thanks to Sirius Healthcare for supporting the mission of our show to develop the next generation of health leaders. We couldn't do what we do without sponsors like Sirius. Now, on to the show. All right, the ONC for Health Information Technology has released its 2020 to 2025 Federal Health IT Strategic Plan. And today we take a look at that with one of the people who pulled it together, Seth Pazinski, the director of the Strategic Planning and Coordination Division of the ONC for Health Information Technology. Seth, welcome to the show.
Thanks. Welcome, and thanks for having me on the show.
Yeah, I'm looking forward to it. This is an important strategic plan. It covers 5 years, and I'm really looking forward to just diving in. But I'd be remiss if I didn't open with just one question on. Tell us. People are thinking, hey, 2020 to 2025, we just have a new administration. Tell us about the continuity of strategy and planning between administrations and maybe over the years.
Sure, thanks for the question. So while we can't speculate on what happens from one administration to another, the strategic plan does provide a foundation for health IT for the federal government. And just a reminder that the previous strategic plan came out in 2015, and it helped the federal government take steps in advancing interoperability of health information. And the mission from that prior plan to this plan remains the same: to improve the health and well-being of individuals and communities using technology and health information that is accessible when and where it matters most. And we've seen a lot of continuity and bipartisan support in the past. And in both of the significant legislations for ONC and that have shaped prior strategic plans, and this one with the High-Tech Act and the 21st Century Cures Act, the plan incorporates those legislations and sets that as a key piece of the federal health IT strategy.
Yeah, and we're going to talk, and we do talk a fair amount on this show about the 21st Century Cures Act, and I think that it will be interesting to see that as a foundation moving forward for how things are going to change. So let's just dive into the strategic plan. But first, tell us about the process. How do you come up with the plan? What's the process you go through for developing the plan?
Sure. The High-Tech Act is what provides the statutory requirement for the Office of the National Coordinator for Health IT to maintain a federal health IT strategy. And it also requires us to work in collaboration both with our public and private sector partners to develop the plan. So this plan was led by ONC, but was developed in collaboration with around 25 different federal organizations. We convene those federal partners in a series of working sessions to develop the initial draft. That draft was put out for public comment. And during that public comment period, we engaged our Health Information Technology Advisory Committee, which is a federal advisory committee to the National Coordinator, to provide us feedback on the plan. We also received nearly 100 public comment submissions as a part of the public comment process. And all of that public input, all of that input from our federal partners is what helped to develop and shape the final plan that was released.
Is there an underlying set of assumptions around the problems that we're facing that inform the plan from year to year?
Yes, there was extensive background research done in order to provide the context and understanding for the development of the federal health IT strategy. And in the plan, we focus on both the challenges within the current healthcare system, so a broader context than just health IT specifically, but what are those things happening in the healthcare industry that can affect health IT. And then we also look at what are the opportunities in a digital health system that are enabled or empowered because information is electronic and can be accessed, exchanged, and used more easily. So we look at things from the broader healthcare context, the increasing healthcare spending. We also look at increasing rates of mental illness and substance use disorders. And we look at the challenges to both care and technology, as well as the ability to access, exchange, and use that electronic health information. And within that broader healthcare context, we take a look at, okay, what are the opportunities in a digital health system? So empowering patients, that's the foundation and one of the primary drivers with the federal health IT strategy is providing access to patients and individuals to their own health information. We also look at the continuing to move forward in value-based care, advancing interoperability of information, as well as promoting new technologies and competition, along with the ability to reduce regulatory and administrative burden on clinicians. Those are some of the foundational pieces that we look at as our unique opportunities in a digital health system.
Yeah, so you have 6 principles that underlie the strategy. I'm just going to run through them real quick, and then I want to touch on them. So you put the individual first, focus on value, build a culture of secure access to health information, put research into action, encourage innovation and competition, and be a responsible steward. Let's start with the first one. This is the one that really stands out to me. Put the individual first has really been a hallmark for quite some time, but it's really been a hallmark of the verbiage that Seema Verma has been talking about and Secretary Azar, but really Seema Verma has been out there talking about the patient at the center, transparency, and all those things. What does it mean? What does this strategy pull out? What does it mean for the individual to be first? What does that concept, put individual first, mean?
So within the 2020 to 2025 Federal Health IT Strategic Plan, the goals and objectives there are at the top priority, and the number one aspect of that is focusing on individuals getting access to their electronic health information. We see that as the foundation of putting patients first. It puts them, that access to their information puts them in a better position to manage and control their health along with their health information. So that's really the foundation of the plan and the foundation of the Federal Health IT strategy. And ONC, in collaboration with our federal partners, are focusing on those cross-cutting areas across the plan that will promote modern health IT for all stakeholders, as well as address those barriers to access, exchange, and use of electronic health information. Again, the choice to put patients first on this list of our priorities was intended to indicate that is our top priority.
Yeah, you also have build a culture of secure access to health information. Is that just taking it to the next level in terms of talking about the need for privacy and security around the patient accessing their information and the sharing of information?
Certainly includes privacy and security. I would say it more broadly reflects the focus of one of the objectives within the Federal Health IT Strategic Plan is to set expectations for data sharing. Those include privacy and security of information. And you can see that embodied in some of the policies that are coming out within the 21st Century Cures Act final rule from ONC, for example, setting requirements around privacy and security. And we anticipate that as well through programs like the Trusted Exchange Framework and Common Agreement that will continue to establish those data sharing expectations for the various stakeholders who are sharing information across networks.
All right, so you introduce the 4 goals in the strategic plan framework: promote health and wellness, enhance delivery and experience of care, build a secure data-driven ecosystem to accelerate research and innovation, and connect healthcare with health data. Let's walk through these, and I think this really becomes down to the heart of the plan and how it gets fleshed out. Promote health and wellness. What are some of the objectives that are supported with health technology in this plan?
So it is intentionally a broad strategic plan that reflects the various roles that federal agencies play within the healthcare and health IT industries. And at first and primary, when we began working with our federal partners, we wanted to develop an outcomes-driven plan. So we were focused on who benefits as a result of the implementation of the strategy. You'll see that we highlight a variety of stakeholders, including patients and populations, the caregivers, healthcare providers, payers, public health professionals, researchers, and others, who really are the key groups that we hope in particular will benefit around the first three goals of the plan: promoting health and wellness, which is around those patients, caregivers, populations, enhancing the delivery and experience of care. So again, focused on patients there, but also how the stakeholders like healthcare providers and payers are engaged in the system. The third goal is really around researchers and innovators, developers, around building that secure, data-driven ecosystem to accelerate research and innovation. And then the fourth goal really cross-cuts the first three. It's around that policy and technical infrastructure that can support the other three goals and the organizations that we hope will benefit from those goals. And we have seen already some of the federal agencies taking steps to build off of this federal health IT strategy, with the Federal Electronic Health Record Modernization Program Office adopting the same goals in their interoperability modernization strategy, supporting the Department of Defense and Department of Veterans Affairs. And specifically around that first goal, around promoting health and wellness, it's really about making sure that individuals have access to usable health information. Again, continue to focus on that patient access piece. The second part of that is about advancing healthy and safe practices through the use of health IT. And then the third part is around integrating health and human services information. So we're also taking a look at things like social determinants of health and how individuals can be supported outside of the traditional healthcare system. Those are some of the ways that we're looking at promoting health and wellness and using technology and health information to support individuals and populations.
All right, we'll get back to our show in just a minute. I want to give you an update on the Clip Notes referral program. For those of you who don't know what Clip Notes is, what we have done is we create a summary of what goes on each show, and we get that into your inbox 24 hours after the show airs. So what you get is a brief summary of the show. You get bullet points as to what the high points were with timestamps, and then you get 1 to 4 video clips. So if you just want to see the highlights, the key moments of the show, you can just click on those, watch those, and stay current. We did that in response to some of the things you guys were telling us, made it easier for you to share the content of the show with your peers, with your staff, with others, and it's a great way for you to stay current, especially when you're busy and you can't listen to every episode. So we wanted to make sure that you have an easy way to stay up to date as to what's going on the show. As a result, because you told us this has been such a great service, we created a referral program because we want to get this in the hands of as many people as possible, and we can only do that through you. And so what we did is we said, all right, let's do a competition. Everyone likes a competition, so we came up with some prizes and some ways for you to refer this out to your friends, to your staff, to people within your organization. The prizes are pretty straightforward. Everybody who does a single referral will be entered into a drawing to win a work from home kit from This Week in Health IT. If you get up to 10 referrals, you get a black moleskin notebook delivered to you. It has This Week in Health IT logo embossed on it. I love the moleskin notebooks. I use them all the time. And then finally, the person who gets the most referrals will be given the opportunity to come on the show to do a Tuesday Newsday episode with me. That's the episodes that I usually do with Drex DeFord. And you're going to get invited to come on and talk about the news with me. It's really straightforward, a lot of fun. It's really conversational. We'll have a great time doing it. And I hope that you are excited about this, as excited as I am. To have people put your name in for a referral, right now, if you go out onto our website, hit subscribe, there's a new box in there that says referred by. If they put in your email address, you'll get credit for each referral that they put in there. We already have people that are approaching the moleskin notebook level, so keep pushing through, and we've had just a ton of referrals to this point. So we really appreciate all that you guys are doing, and we hope that the content is helping you to stay current and helping you to do your jobs more effectively. With that in mind, let's get back to the show. Yeah, I often say that this show is the education of Bill Russell, and so you're going to educate me on how the government works a little bit here. When you say things like improve individual access to usable health information, would that inform like the FCC's goal to increase access in rural and remote communities? to health as well as access to health information? Is that how that works?
Yeah, so for example, one of the strategies that we focus on is improving access to smartphones and other technologies, and in particular among at-risk, minority, rural, disabled, and tribal populations. And so there are various federal agencies that focus on specific populations that they serve, and across those agencies, as they pursue their missions in supporting those different populations, they're leveraging health information technology as well as making sure that those individuals have access to information. So that's a mix of things like, particularly what we've seen even during the COVID-19 pandemic, is within rural communities, access to broadband, access to telehealth. Those are ways that leveraging technology to improve access to usable health information.
It's interesting. It's interesting how this gets used. So if I'm with another part of the federal government and I'm thinking about health disparities or social determinants, or I'm thinking anything regarding health and technology, I would refer to this plan, and I might even adopt some of these plans, some of these aspects as we're developing our goals and guidelines for moving forward. Is that how that works?
Yes. So there's really 4 ways we focus on working with federal partners and how we would anticipate federal agencies using the plan. The first is to prioritize resources. So the plan is an opportunity for individual federal agencies, whether it's through their budget request or internal planning, to look at what are the priorities that have been established as part of the federal health IT strategy. The second piece, which is a really big part, is around aligning and coordinating efforts. And I mentioned that we are seeing other agencies, for example, align their strategies to this federal health IT strategic plan. It's also a way for us to coordinate across the federal agencies that are engaged in health IT, which is numerous, and we can coordinate on things like standards. The federal government is actively, working across our partners, and ONC is facilitating that coordination around things like the fire standard and how that can be expanded and used for a variety of federal health IT use cases across various agencies. So it's a way, for example, to agencies to come together and align around common standards. It can also be used to signal priorities to the private sector. So while this is a federal plan and speaks to what the federal activities would be, it also can be used as a communication to inform the private sector what are the priorities of the federal agencies. And then the last part is it can also be used as a way to benchmark and assess progress. And so we are focused on, within ONC, and working with our federal partners around 5 cross-cutting areas that we think will help advance overall the goals of the strategic plan. That's, one, as I mentioned, around promoting the use of the fire standard across federal organizations. Also, we're looking at using secure standards-based application programming interfaces to provide electronic health information. A third piece, again, another standards piece, is around building off the U.S. Core Data for Interoperability standard that was established in ONC's 21st Century Cures Act final rule, and building off that for additional data classes and elements that support federal use cases. And then the last 2 pieces are around those data sharing expectations. So deterring information blocking practices using federal authorities and investments, and then encouraging data exchange across networks at both the national and community levels. So those are the things that, as we look forward to implementing the plan, that's what we're anticipating from an ONC standpoint, focusing a lot of our coordination efforts with our federal partners.
What's interesting, a lot of health systems are focused on the experience and the delivery of care, and you have a whole section of this as you talk. The second goal of this is enhance the delivery and experience of care. Talk about, and this is pretty extensive. You cover, as you said earlier, you cover everything from research to payers to providers, and how people are able to utilize technology and the burden sometimes that comes along with the technology. So talk a little bit about what you're trying to achieve in the experience area. of the plan?
The plan really, and ONC did a specific strategy in response to a congressional requirement that was focused on provider burden reduction. So this plan, takes into account those specific activities and recommendations that were described in that joint strategy from HHS on reducing provider burden. It acknowledges that clinicians face a significant amount of time entering data and other documentation in EHRs for reimbursement purposes, quality, public health, registry reporting, prior authorization. So it looks at how we can do things like simplify and streamline documentation, promote the use of evidence-based automated tools, as well as streamline processes to reduce the level of effort for healthcare providers and health systems in responding to those federal requirements. So ONC is actively engaged on those pieces. And for example, we're currently working with our Health IT Advisory Committee in a task force that's focused on the intersection of clinical and administrative data, looking for efficiencies in how we can merge those data for purposes of improving the prior authorization experience. So we're actually looking forward to getting recommendations from our Federal Advisory Committee later this year on what would be some recommendations and activities that ONC and federal partners can take to address those aspects of clinician burden.
So could that lead to a reduction in the regulatory burden in some way, or a reduction in the way we report or the number of data elements or those kind of things? Is that what that potentially leads to?
That's the intent of the objective within the plan, is to reduce that regulatory administrative burden. So taking those administrative requirements and allowing clinicians to have more time with their patients and have a better overall experience with delivering healthcare. And again, ONC put out an entire strategy focused on recommendations there for both ourselves and some of our federal partners. And we're working to take steps against that strategy.
So you talk about the data-driven ecosystem, and on this show, we focus an awful lot on provider-to-provider sharing, and we talk a little bit about provider and payer sharing. But this has a broader aspect to it of pulling in data. Obviously, our health is more than just our visits to the healthcare system. Our health is about the individual decisions we make, where we live, the disparities. There's a lot of different aspects that come into it, which sometimes just gets lumped under social determinants. But there's a lot of different data sources out there. Talk about maybe the concept or the vision for how we expect to bring all the different data elements to bear on the health of a population.
Yeah, so we talked about an integrated ecosystem, and that is one that respects privacy and security as far as the collection of information, but also focuses on collecting data from multiple sources to unlock the power of that information. And so with access to data and technology, it creates the opportunity for advancements in analytics. So things like machine learning and artificial intelligence, and the ability to forecast and have the potential to transform care and improve health. And those are some of the key aspects of this goal, both in accelerating research, accelerating innovation, but also then reducing the time it takes to translate that learning into decisions at the bedside. So furthering provider access to data stored in EHRs and apps, and in particular, leveraging secure standards-based application programming interfaces to empower individuals, providers, payers, public health, researchers, all those stakeholders in the ability to both collect that information and then use it to gain knowledge and learning in healthcare.
There's an awful lot of innovation coming down the pike. We have AI, machine learning. We have FHIR is opening up access to data stores. We have new entrants and new players. We have big tech coming into healthcare. The thing about this is it again, patient first, I'm going to get the wording wrong. The individual first you're looking to create a framework where technology is used to provide the best care to an individual or best care to a population. It doesn't really necessarily favor a provider or a payer or a researcher or big tech or pharma. It just provides a framework for how technology can be used for those people. That's how I'm reading that. Is that essentially, or am I missing the mark a little bit there?
No, that's a key, part of our focus, and our messaging really is about promoting modern health IT for all stakeholders. So you heard me speak earlier about the variety of stakeholders engaged here, and it does go from patients to healthcare providers, researchers, public health, payers, really all benefiting from having appropriate access, exchange, and use of health information. And going back to some of the points that we emphasize for ONC collaboration and coordination purposes with our federal partners, it is some of those technical pieces that broadly support stakeholders, like providing access through the secure standards-based application programming interfaces, as far as accessing both individual patient information, but also information at a population level. It focuses on common standards so that we're building off of the FHIR standard and supporting various use cases and various populations that federal agencies serve. Same thing with the U.S. Core Data for Interoperability, which gets down to those data elements and classes to improve interoperability and making sure that they can support a variety of federal use cases and populations. And then the last piece really is about what's that expectation for data sharing, so that data does appropriately follow and go to where it needs to be. And that's around making sure that we're deterring information blocking practices and encouraging that appropriate data exchange across networks, both at the national and community levels.
Well, Seth, this is great work, and I really appreciate you coming on the show to share it with us. How can people get access to this? I downloaded it off the website. Is that the best place for people to go? Where would they go to get the report?
Yes, healthit.gov is where the report's located. And I'll also say that as far as tracking how this progresses in the future, we will again be looking at some of those cross-cutting technical and policy pieces that we think will help support and benefit the individuals that we've mentioned so far. And ONC publishes an annual report, which is submitted to Congress, that talks about what is the current state of health IT in the industry. That's also available on healthit.gov. The last version of that was put out in early 2019. So the next update to that report to Congress that lays out what are the persisting barriers, what are the actions being taken by federal agencies, and what are our recommended paths going forward. We'll continue to communicate through that report. Again, that's available on healthit.gov as well. And we see that we intend to align that report to be our primary way that we're communicating progress against the federal health IT strategy. So both accessing the plan as well as keeping track of how things are progressing, encourage folks to go to healthit.gov and check out those resources.
Yeah, it is really a well laid out site. It's pretty easy to find. October 30th, news, Federal Health IT Strategic Plan supports patient access to their own health. And then there's a link right there. You could also get it off the blog as well. And actually, it's just a really easy to navigate website. For those who are wondering if a government website's easy to navigate, this one is fairly easy, has a ton of great information. Again, Seth, thanks for coming on the show. I really appreciate it.
Thanks for having me, and thanks for the opportunity to talk about the Federal Health IT Strategic Plan. Really appreciate it.
That's all for this week. Special thanks to our channel sponsors, VMware, Starbridge Advisors, Galen Healthcare, HealthLyrics, Sirius Healthcare, ProTalent Advisors, Health Next, and McAfee for choosing to invest in developing the next generation of health leaders. We really appreciate their support. Don't forget to sign up for Clip Notes, send an email, hit the website. We want to make you and your system more productive. This show is a production of This Week in Health IT. For more great content, check out the website, thisweekhealth.com. Check out our YouTube channel. We continue to modify that and make that better and easier to find things that you are looking for there. Please check back. Every Tuesday we do Newsday. Every Wednesday we try to do a solution showcase. Every Friday we do interviews with industry influencers, and we will continue to do that through the end of the year. And then we have some interesting things lined up for the new year, and I can't wait to share those with you, and we will start sharing those with you here shortly. Thanks for listening. That's all for now.